following consultations with the Council of Governors and also with the advice of the National Emergency Response Committee to COVID-19 and the National Security Council, today again I issue Public Order number 4 of 2021. And that is number 1, that the hours of curfew are maintained at between 7 p.m. and 4 a.m. in the COVID-19 hotspots which comprise the counties of Kisumu, Siaya, Homa Bay, Migori, Busia, Kakamega, Vihiga, Bungoma, Kisii, Nyamira, Kericho, Bomet, and Trans Nzoia up to the 31st of July 2021. That for the rest of the territory of the Republic of Kenya, the nationwide curfew shall continue to be observed from 10 p.m. to 4 a.m. for a further containment period of 60 days. That excluding the above-mentioned counties, in-person worship and congregational worship shall continue to be conducted in keeping with the one-third capacity rule and in accordance with the guidelines of the Interfaith Council. That the prohibition against public gatherings is extended for a further 60 days. That all persons coming into the country must be in possession of a negative COVID-19 PCR certificate acquired no more than 96 hours prior to arrival into the country, with the PCR certificate also having been validated by the trusted travel platform for those traveling by air. That duly classified and licensed hospitality establishments must continue to adhere to the guidelines issued by the Ministry of Health. The establishments must also ensure the adoption of and compliance with the tourism safe travels protocols developed by the hospitality sector themselves. In regards to funerals, cremations, and other interment ceremonies, it is directed that these ceremonies shall be conducted strictly within the 96 hours of confirmation of death. That the attendees, officiators, and facilitators of funerals or graveside cremation ceremonies shall be limited to 100 persons in total. That the attendees, officiators, and facilitators of wedding celebrations, of marriage or traditional union ceremonies or rites of passage, and all other similar events or ceremonies shall be limited to 100 persons in total. That all hospitals are directed to limit the number of visitors for hospitalized patients to 1 visitor per patient per day, and that all other rules, guidelines, and protocols not reviewed through this public order shall continue to apply until otherwise notified. Fellow Kenyans, the second path out of the COVID fog for Kenya is an opportunity with a promise. When we reported the first case of COVID-19 more than 15 months ago, the idea of a vaccine was nowhere in our minds. 1 year later, in March 2021, we were able to roll out a national vaccine deployment plan, and our strategy was to vaccinate 10 million adults by June of this year and approximately 16 million by June of 2023. But inspired by acceleration doctrine, which is about constantly increasing the speed of achieving our goal, we revised our vaccine plan, and instead of vaccinating 10 million adults by June of 2022, we expect that we will vaccinate the entire adult population of Kenya, which is 26 million people, by the end of this year. In fact, by Christmas of this year, we intend to have vaccinated over 10 million adults, according to our experts, and we will have built a capacity to vaccinate 150,000 people every day as of August of 2021. And this accelerated plan will be aided by a few swift, bold actions and programs. For instance, we have already ordered 10 million vaccines from Johnson & Johnson, with the first consignment arriving in Kenya in August of 2021. But in the process of negotiating with this company, we also have managed to get a lower price. For the price of 10 million vaccines, we will be able to have them deliver 13 million doses. And because the Johnson & Johnson vaccine is administered using a single shot, the speed of rolling out our vaccination program will therefore be accelerated. Using these vaccines and others in the pipeline, this is how we will vaccinate over 10 million Kenyans by Christmas of 2021 and 26 million Kenyans by the end of 2022. And if a vaccine for underage populations is registered by early next year, we intend to vaccinate an extra 4 million young adults by June of 2022. With a vaccinated population of 30 million people, this will allow us to begin the journey for herd immunity against this pandemic, and this is our intention for the next 12 months.